Hello, welcome to Sonography Radiology Training channel. This series of videos is about umbilical cord imaging. This is the second video in this video series with title of Prenatal Assessment of Wharton Jelly. The outline of this presentation include introduction, ultrasound technique of Wharton jelly measurement, lean umbilical cord, large umbilical cord, the importance of Wharton jelly measurement in single umbilical artery fetuses, the correlation of Wharton jelly and placental pathology, and the role of Wharton jelly measurement in twin-twin transfusion syndrome, and final teaching points. At first, introduction. Wharton jelly, or the connective tissue of the umbilical cord, is derived from the extraembryonic mesoblast. Wharton jelly that surrounds and encompasses the umbilical vessels is composed of a grand substance of open-chain polysaccharides, which comprise a fine network of microfibrils dispersed in a small amount of collagen. These contents of Wharton jelly yields a relatively firm structure which enables contraction and distension of the umbilical cord vasculature. Reflecting the inherent strength of this vital structure, the average tensile breaking load of the umbilical cord has been reported at 2.5 times birth weight. The walls of the arteries are muscular and contain many elastic fibers which contribute to a rapid constriction and contraction of the umbilical vessels after the cord is tied off. In this fashion, Wharton jelly, the umbilical arteries, coiling, suspension in amniotic fluid, protect and buffer the umbilical cord from twisting, shearing, torsion and compression forces throughout gestation and specifically during fetal descent during labor. Ultrasound technique of Wharton jelly measurement. Here is an important question. How is the ultrasound technique of Wharton jelly measurement done and what is its importance? First, we must obtain accurate transverse section of umbilical cord in a good amniotic pocket so that the cord margin could be accurately delineated. Thereafter, the region of interest is focused and further zoomed so that caliper tracing could be done as precisely as possible. The ellipse function of the ultrasound machine is used and the best fitting ellipse is put over the umbilical cord and its vessels. The area of Wharton jelly can calculate it by subtracting the total vessels area include arteries and vein from the umbilical cord area. If we numbering these areas, this is 1, 2, 3, and 4. So Wharton's jelly area equals total umbilical cord area minus the summation of the area of the first umbilical artery plus area of second umbilical artery and the area of the umbilical vein. According to this measurement, many articles have been published on Wharton jelly area measurement and numerous nomograms have been presented. Some of them is based on percentile and the others present mean value for each gestational age with standard deviation. Based on these nomograms, two definitions are proposed. At first, lean umbilical cord means Wharton's jelly area less than 10th percentile for gestational age, and large umbilical cord means Wharton jelly area more than 95th percentile for gestational age. This image is related to a small gestational age fetus at 29 weeks gestation in our center. As you can see, the Wharton's jelly area of this patient is less than 10th percentile for gestational age. Lean umbilical cord. If we detect a lean umbilical cord by prenatal sonography, what can it indicate? At first, may serve as a simple identifier of a fetus's destined to a small for gestational age birth weight, like our patient. Second, the incidence of meconium stain was higher among fetuses with a lean umbilical cord. The number of infants with a 5-minute UPCAR score less than 7 considerably higher in these fetuses. The proportion of fetuses with oligohydramnios at delivery was higher also. Large umbilical cord. Another one, we must ask, if we detect a large umbilical cord by prenatal sonography, what can it indicate? The proportion of cases with a large umbilical cord was significantly higher in the group of macrosomic infants. Also, significantly higher among macrosomic fetuses of patients with diabetes versus those without diabetes. In addition, the combination of abdominal circumference more than 95th percentile and large umbilical cord predicted 100% of macrosomic infants. Finally, these authors concluded that sonographic assessment of umbilical cord area may improve detection of macrosomia. You can find full explanation about fetal macrosomia in this video. The importance of Wharton jelly measurement in single umbilical artery fetuses. This study reported that a decrease in Wharton jelly often occurs in cases of single umbilical artery, possibly an additional risk factor for fetuses with nuchal cord, as you can see in this fetus with 2 coiling nuchal cord. The association of adverse prenatal outcome noted in cases of single umbilical artery, even in the absence of congenital or chromosomal abnormalities, likely reflects the decreased amount of Wharton jelly. Thus, the combination of a single umbilical artery and decreased amount of Wharton jelly may represent a combined compromise of teleological protective mechanisms of the umbilical cord, resulting in increased adverse prenatal outcome of fetuses further complicated by the presence of nuchal cords and especially multiple nuchal cords. You can find full explanation about single umbilical artery in this video. The correlation of Wharton jelly measurement and placental pathology. This study reported that decreased Wharton jelly is associated with clinically significant placental pathology and Wharton jelly area scales proportionally with placental size. You can find full explanation about abnormal placental shape and thickness in this video. These findings support the concept that Wharton jelly area as depicted by prenatal ultrasound correlates with the functional capacity of the placenta and thus merits further evaluation with currently available tests of placental function in clinical practice. The importance of Wharton jelly measurement in twin-twin transfusion syndrome. This paper studied 21 twins with twin-twin transfusion syndrome. This image is related to one of our patients with twin-twin transfusion syndrome in monochronic diamniotic twin pregnancy. As you can see, this is the recipient fetus with full bladder and this is the donor fetus with empty bladder. This study demonstrated that the cross sections of the umbilical cords of the recipient twins were larger than those of donor twins. In our patient, in addition to twin-twin transfusion syndrome, we found incidentally Velamentous cord insertion and Vasa Previa in donor fetus. You can find full explanation about Velamentous umbilical cord insertion and Vasa Previa in these videos. The difference was attributed to both the larger amount of Wharton jelly and also a large umbilical vein diameter. The proportion of the lean umbilical cords was higher in the donor versus recipient twins, while larger umbilical cords were significantly more frequent among recipient versus donor twins. Now, please pay attention to these final teaching points. Lean umbilical cord or decreased Wharton's jelly area may serve as a simple identifier of fetuses destined to a small for gestational age, meconium defecation, 5-minute UPCAR score less than 7, and oligohydramnios. The proportion of cases with a large umbilical cord is significantly higher in the group of macrosomic infants. The association of adverse prenatal outcome noted in cases of single umbilical artery, even in the absence of congenital or chromosomal abnormalities, likely reflects the decreased amount of Wharton's jelly. Decreased Wharton's jelly is associated with clinically significant placental pathology and Wharton's jelly area scales proportionally with placental size. The proportion of lean umbilical cords in twin-twin transfusion syndrome is higher in the donor versus recipient twins, while larger umbilical cords are significantly more frequent among recipients versus donor twins. Now, I suggest two others of my videos that are close to this video in terms of matter. And thank you for your attention.